we're going to do some SBAs that we'll just whiz through. So the first question is, which ethnicity is most affected by GTD? And the answer being Asians. Question number 2, the prevalence of GTD in the UK is, and the answer is 1 in 714 live births. Now, the genetic makeup of 90% of partial moles is either A, B, C, D, or E, and the right answer is C. How would you go about managing a suspected molar pregnancy at 10 weeks? Would it be medical management, watching and waiting, hysterectomy, chemotherapy, or suction and curettage? We would definitely not do watch and wait, we would do suction and curettage. Question number 5, if a complete molar pregnancy occurs within a viable twin pregnancy, what is the likelihood of the viable twin surviving until delivery? Is it 5, 10, 20, 25, or 40%? It's bang on a quarter, 25%. Now, question number 6, women who have had GTD are referred to the Gestational Trophoblastic Disease centres, which are located where in the UK? The answer is definitely not E, it's B, London, Sheffield and Dundee. And follow-up testing constitutes monitoring of which hormone? Is it AFP, CRH, HCG, CA125 or MSH? The answer is HCG. Question number 8, excessive Beta HCG does not cause which one of the following symptoms? Is it irregular bleeding, large verdates, excessive hyperemesis, pelvic pain, or shortness of breath? The answer is shortness of breath. That is caused by distant metastases seen in GTN. Question number 9, treatment choice for GTN is based on which criteria? Is it the figure 2000, Duke's criteria, Child Pugh, CDC criteria, or Charcot's criteria? The answer being A, the figure 2000 WHO criteria. And the final question, question number 10, successful outcome of treatment of GTN with a FIGO score of greater than or equal to 7 is 95%. Great. Well, thank you very much, everyone. The main summary of the talk that we've done today is that moles are precancerous and occur with abnormal fertilisation. The definitive treatment for them is surgical, and all women require referral to one of the specialist centres as a minimum standard of care. GTN is the persistence of this disease and is usually treated with chemotherapy with really high success rates. Thanks once again. If you could click on the link and fill out a feedback form, that would be great, just to see what I can improve on. And thank you once again for watching the video.